So let's talk a little bit about the health impact. Now, I wouldn't be a credible source if I didn't talk about some positive effects of marijuana. So why do people use marijuana? So in many ways, it's for the high, right? It's for the euphoria that people experience when they use marijuana. It decreases tension. It depresses you a little bit. It makes you more mellow, and that's that's not a medical term, but people use it for decreasing tension. And some people use it to fight chronic or severe pain or intractable nausea. And there's some evidence that marijuana does help with intractable seizures in children, called Dravet's syndrome. But all the rest of the uses of marijuana are not evidence-based, but people do use it to treat symptoms. So I wanted to be very clear and honest with you that there are, in many people's minds, positive effects of marijuana. So let's talk about the other impact or the other consequences of marijuana. So when you think about why people use marijuana, they try to calm tension, decrease anxiety, to get the high. But I don't think they realize that it also impairs thinking, their process of coordination. It can impact, as the police folks would tell you, it can impact their coordination and their driving skills, although people would not admit to that freely. Of course, people who are drinking with alcohol and driving also don't admit to their lack of coordination. But it does impact on all of those things. And if you think about, remember, the adolescent brain and their impact while they're studying, while they're interacting with their peers, if you have impairments in your thinking, you are not present necessarily in the critical pieces and able to really integrate all those things and functions that you're dealing with. On a more severe note, and I'm not going to read through this slide, and it's a very intense slide because I wanted to give you the facts that are currently available. There are a lot of bad consequences associated with marijuana, and particularly as you increase the amount of the concentration of THC, as well as increase the chronicity of using it, people can be severely intoxicated. And we're seeing increasing numbers of children coming into the emergency room because they mistakenly have eaten an edible when they didn't know it. And particularly as they market some of the edibles are candy-like or sucker-like, so that children can be exposed to marijuana at very large concentrations. And in adults, and I'm not going to read this slide to you, it can cause severe problems, and in some cases even death, although the burden of marijuana use is not as large as the burden of alcohol and tobacco. I just wanted to be reflective of you, but do talk about the importance and the significant health consequences. So, despite what teenagers believe, and the general public, particularly young adults and adults, there are significant consequences to using marijuana, not only acutely and in large concentrations, but chronically as well.